Clindagel Gel is a medication used to treat acne by decreasing the number of acne lesions. It contains clindamycin, an antibiotic that works by stopping the growth of bacteria. The recommended dosage and optimal timing for using this medication should be discussed with a healthcare professional. When using Clindagel Gel, it is important to apply it only on the skin after cleaning and drying the affected area. For the lotion, shake the bottle well before using and apply a thin layer to the affected area twice a day. If using the medicated pad or swab, gently apply to the affected area and discard after use. Depending on the size of the area, more than one pad or swab may be necessary. For the foam, apply it once daily to the affected areas as directed by your doctor. Make sure to cover the entire affected area and avoid spraying the foam directly onto your hands or face. Wash your hands after use and avoid contact with your eyes, nose, mouth, or any areas of broken skin. It may take 2 to 6 weeks to notice an improvement and up to 12 weeks to see the full benefit. If your condition does not improve or worsens, be sure to inform your doctor. If you experience burning, itching, dryness, redness, oily skin, or skin peeling, it's important to tell your doctor or pharmacist. This medication may be absorbed into your bloodstream and very rarely cause a severe intestinal condition due to a bacteria called C. difficile. If you develop symptoms such as diarrhea that doesn't stop, abdominal or stomach pain/cramping, or blood/mucus in your stool, it's important to seek medical attention. Additionally, a very serious allergic reaction to this drug is rare, but it's important to seek medical help right away if you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, it's important to contact your doctor or pharmacist. Before using Clindagel Gel, make sure to inform your doctor or pharmacist if you have any allergies to clindamycin, lincomycin, or any other allergies. This gel may contain inactive ingredients that can cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. Also, inform your doctor or pharmacist about your medical history, especially if you have chronic asthma or hay fever, intestinal diseases such as ulcerative colitis or enteritis, or if you have had C. difficile-associated diarrhea in the past. If you are planning to have surgery, be sure to let your doctor or dentist know about all the medications you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, inform your doctor before using Clindagel Gel. It is also unclear whether the medication in this gel passes into breast milk, so consult your doctor before using this product if you are breastfeeding. When using Clindagel Gel, it's important to be aware of any potential drug interactions that could affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Clindagel Gel. If someone has taken too much Clindagel Gel and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to note that Clindagel Gel can be harmful if swallowed. This medication is for external use only. Use it as directed by your doctor. Do not use more of it, do not use it more often, and do not use it for a longer time than your doctor ordered. To do so may cause your skin to become irritated. This medication is not for use in the eyes, mouth, or vagina. Do not use it on skin areas that have cuts or scrapes. If it does get on these areas, rinse it off right away with water. To help clear up your skin completely, it is very important that you keep using this medicine for the full time of treatment, even if your symptoms begin to clear up after a few days. Since acne treatments can take weeks to months to work, you must be patient and continue to use this medication regularly to help keep your skin clear. If you forget to apply a dose of Clindagel Gel, apply it as soon as you remember. If it's almost time for your next dose, skip the missed one and continue with your regular schedule. Don't apply double the amount to make up for the missed dose. When using Clindagel Gel, it's important to store it according to the specific instructions on the product package or as advised by your pharmacist. Be sure to keep all medications out of reach of children and pets. When it comes to disposing of Clindagel gel, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on the proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.